Yes, my mom does have a Medicare Advantage Plan, and it's through Humana. So it's kind of a no-win situation. We have a Medicare Advantage Plan, and it's Humana, and doctors are just dropping Humana in general left and right. Now, she's had it maybe 4 or 5 years, this plan, and it's so funny because I was sitting here thinking, I'm like, man, I remember when we were still having problems with when she had straight Medicare. Now, granted, it's only this past year we have collected new doctors. Normally, she just has her primary care and her neurologist. Once in a while, an ENT for, ear cleaning. But she still had problems while on Medicare. And again, I think it's because her situation is unique because of her specific health problems. She would have to get approval for her MRIs because back in the day she was getting MRIs a lot because her MS, she would have little episodes, so the doctor wanted to see what was going on with the lesions on her brain. And because of the medications she was taking could cause PML, which is kind of like a brain cancer stem cell problem, and MRIs can help predict if that's happening. So often her MRIs would be denied by Medicare, and we would have to resubmit the paperwork with different codes and different explanations, and it was a hassle because sometimes she could have like 5 MRIs a year, and normally they only kind of want to cover 1. So that was a problem we'd have with Medicare. And then the second one was her MS medications, when she was on them at the time, were not covered by her Medicare plan. And the neurologist would have those phone conversations, the doctor to doctor, we would appeal, and every single one of the medications would be denied. And she went on a few as her disease progressed. And it was to the point where she was getting some like chemotransfusion drugs, and those definitely were not being covered because she was not receiving them as a chemo treatment. And they were like $20,000 an infusion. So her neurologist would sign her up for research studies. So we would get those medications for free, and then she would be enrolled in this study, and every couple weeks we'd have to go in for appointments and answer questions and get checkups. But it allowed her to get her drugs that Medicare would otherwise have denied. And that's not to say the Advantage Plan wouldn't deny it either. But I still struggled with the Medicare plan because of those 2 specific needs we had. Now, honestly, I'm not perturbed, like I'm frustrated with referrals. In general, it's why my husband and I have medical plans that don't need referrals. But it's not that we need referrals that is just ticking me off. It's communicating with the doctors, be it for referrals or otherwise, because now we're involving call centers and we're involving third-party companies that handle the referrals rather than the office themselves. So it's the communicating with the doctors that are just infuriating me more so than just needing a referral. Because back in the day, referrals were much easier to manage than they are now, in my humble opinion, because of this whole tell them we need this code and then we'll do that code. And I know if my mom had straight Medicare, we wouldn't have these problems, but also she gets some perks with the Advantage Plan that serve her well. Like we get over-the-counter, not prescriptions, like over-the-counter pharmacy delivery, and that's super, super helpful to offset costs, because when doctors would prescribe the supplements, they would be denied because you can just go buy them off the store, but that stuff adds up, just buying them straight from the shelf. And they would cover things like a commode or a shower chair, and that's not to say Medicare wouldn't either, but it was actually much harder to get it than it is currently, and that's our situation. I apologize for the light. We're in the middle of a thunderstorm. So, and then we get like the healthy spending card for groceries. If she wanted to join a gym, that would be free. And there is medical transportation available. But it doesn't work out in terms of, like, we would still have to go anyway, because my mom just needs somebody there to help comprehend the visits. But it is nice to know that exists. So, I mean, it's just a trade-off. And she also has Medicaid, so she has like the dual plan. So it's just, it's a trade-off of aggravation in our, circumstances. Which aggravation do I want? Unfortunately. But, yes, part of this is because we need referrals due to the Medicare Advantage Plan. But I'm still saying it's these doctors and call centers and referral companies that are it's what is making this a horrendous process. Because it used to be so much easier to get referrals. I can go on and talk in circles about this, but thank you for pointing that out, and I apologize if I didn't make that clear. In my brain I know it, and when I've talked about like healthy spending card, I take for granted that people wouldn't understand that means it's a Medicare Advantage plan. So thank you for pointing that out, and it allowed me to clarify the situation. But if you needed a referral because of your healthcare plan, you potentially would be running into this problem anyway. But yeah, okay. Thanks for listening to me blab, and I hope you guys are doing okay, and I'll talk to you later. Bye.